go. Good evening, ladies. I'll be talking to you this evening about a condition called diabetes. And I'll be elaborating on type 2 diabetes because according to the American Diabetes Association, type 2 is the most prevalent diabetes in the United States. I will briefly discuss the definition of diabetes, causes of diabetes, examinations and tests, and also I will discuss the treatments. But I will first of all start by giving you a simple definition of diabetes. Diabetes is a problem with the body that causes the blood glucose, which is the sugar level, to rise higher than the normal. And this is also called hyperglycemia. And now there are three types of diabetes. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 is usually called juvenile diabetes. Type 2 is called adult onset, and gestational usually is common in pregnant women. But today I'll elaborate more on type 2 diabetes. And I'll give you the causes of type 2 diabetes. In type 2 diabetes, the insulin that the body produces is either not enough to able to move the sugar into the cell, or you have too much fat in your body to be able to get your sugar to be moved. And another cause of type 2 diabetes is a family or genetic factor. And some of the common signs in diabetes I will give you, common signs that you will see in people that have diabetes. Urinating frequently, that is called polyuria. Feeling thirsty, want to drink all the time, that is called polydipsia. Feeling hungry, even after eating, 10 minutes you want to go eat again, that's called polyphagia. Those are the common symptoms of diabetes. And also there are other serious complications of diabetes. If you've already been diagnosed with diabetes, these are the symptoms that you will see in diabetes. You will have extreme fatigue. And extreme fatigue is caused because your sugar in the blood is not able to be moved. So that means your cell is starving. And if your cell starves, that will cause you to be tired. Another problem with type 2 diabetes or complication is blurred vision. Your eyesight is usually not good, and that will cause you to be diagnosed with something called glaucoma. And most people that are already been diagnosed with diabetes, they do have something that needs to be taken care of. They have numbness and tingling. So for instance, if they get a cut on their feet, they will not tell that they have a cut because of poor sensation or poor circulation. And with all of these, there are tests that usually is done or examination to determine whether you have diabetes. The most common test that they usually do is called a fasting glucose test or fasting blood glucose test. In a fasting blood glucose test, you will not eat during the night, and in the morning they will take your blood to check and see. And usually if your blood sugar is higher than 110 milligrams per deciliter, then that means they will consider you to be diabetic. Another test that is done is called hemoglobin A1C test. This is usually done to determine 2-3 months back if you are somebody that is prone to be diabetic, or if you have diabetes, you'll be able to tell. Even if your diet is good today, but 2 months ago, they'll be able to tell if you're prone to diabetes or you'll be exposed to diabetes. And another test, the final test that is done, is called oral glucose tolerance test. In this test, you will go to a hospital setting, or you go to your doctor's office, they will give you a sugary drink to drink. And every 2 hours, they will call you and take your blood and get that test done. If the number keep coming over 200 milligram per deciliter, you are considered to be diabetic. In this situation, it's not as bad as, it is. At least there are treatments. There are things that you can do to minimize your risk. There are other things that you can do to help with management of diabetes. And I'll give you one common thing that we all can do to minimize our risk for being diabetic. First thing, you have to keep active. Move around. Even 10, 15, 20 minutes a day, it will help minimize your risk of being diabetic. And also, nutrition plays a big role. Eat foods that are high in fiber. Drink a lot of water. Vegetables. Stay away from carbonated drinks like soda. Low carbohydrate food. That will help a lot. And if that doesn't work, then the doctor will usually prescribe you some medicines. And they do have a couple of medications that you will take. Like for instance, insulin. That's the generic medication to mimic the insulin that we already have in our body. So if you don't have enough, you'll be prescribed that. There are other couple of medications, usually as tablets, the doctor will prescribe. I'll give you an example. One is called metformin, and the other one is called glipizide. You'll be able to take these medications. And I will advise all of you all, in the conclusion of this short speech, I will advise all of you all to keep active, exercise, eat right, and stay away from a lot of sugary food, candy, cakes, and all of that. This brings me to my conclusion. And I hope you all will live a healthy lifestyle. And I hope this little information have helped you a lot. I thank you all for your time. And if you have any questions, I can take questions now. You have any questions?
No.
You all understand?
Yes.
Okay. Thank you very much for your time.